reversing PFS, and in this video, guys, I want to talk about why some men don't experience issues with finasteride. Okay, so also there are different effects of finasteride on some guys. Some guys have mental issue. I was like more mentally affected. Okay, so anxiety, depression, panic attacks, and so on. And some guys their sexual functioning is affected. Okay, so and in this video I will explain why some guys have less side effect, and also maybe I will show you one positive effect of finasteride. Okay, there are studies on this. Okay, so as we know, finasteride, they block 5-alpha reductase enzymes. Okay, they block both. Okay, so dutasteride has much stronger effect. Okay, so there must be much stronger effect coming from dutasteride because it's really block like strong both 5-AR1, 5-AR2. Okay, so it should be really a strong effect. Okay, and also dutasteride in that way it blocks more than 80% of your serum DHT. Okay, so also, what is important is to distinguish between serum DHT and local DHT, okay? Because some guys, their serum DHT is okay, but local DHT, okay, or 5-alpha reductase activity in brain or in penile tissue is different, okay? So therefore, even some guys have like normal DHT, they will be affected because they have different activity, like for example in brain there is 5-alpha reductase 1, in penile tissue dominant is 5-alpha reductase 2. Okay, so finasteride is primarily blocking 5-alpha reductase 2, to less extent 5-alpha reductase 1. Okay, so it can be that for some guys it can be also more of 5-alpha reductase 1, like it was for me. Okay, so or I had less, I don't know, neurosteroids in my brain, so that was the problem. I don't know. Okay, right now I don't have answer for everything. I am also ex-PFS, so I know how it feels and why I am so interested in everything around PFS, PSSD, because I suffered from these conditions. Okay, so detox. Okay, this is when you stop finasteride. Okay, so why some guys can recover faster or don't have such a side effect. Okay, so the problem is detox of finasteride. Okay, so the half-life is around 5 to 8 hours of plasma, but like effects on 5-alpha reductase can really takes up to 2 years. Okay, so if your liver is not functioning properly, because half-life is really at least 5 months to restore 5-alpha reductase, okay, in ideal conditions. Okay, so you need to take into account that until these 5 months, somehow finasteride is still present. Okay, so it's metabolized in the liver by the enzyme CYP3A4. Okay, so there are things you can do to support the detox. Okay, like NAC, but for example, warning, if you are low in dopamine, okay, and some guys, some PFS guys are, then it can cause something like anhedonia. But from my experience, because at the time I had also low dopamine, it will end as soon as you end supplementing with NAC. Okay, so it's like short temporary type of anhedonia that can be caused by an NAC. It's like more like blunting emotion or something like that. So it's not like ashwagandha that can have really persistent effect. Okay, milk thistle. Okay, silmarine. I was using this one. Okay, because I had really bad issues at that time, also with liver. So I've been using milk thistle. Be cautious, it's extremely estrogenic. Okay, and you really need to take higher amounts, not to cook or some supplements. The best is crushed milk thistle, and you will eat like, I think at that time I was eating like 4 teaspoons, okay? So every single day for a few months in order to restore liver and functioning of liver and everything, okay? Also, tutka, activated charcoal, okay? So be careful. There are some compounds that can block this enzyme, okay? So if you like grapefruit, you should avoid grapefruit completely. Grapefruit, I like grapefruit, but it's generally well known for interaction also with medication and so on due to inhibiting CYP3A4 enzyme, okay? So grapefruit contains a compound that inhibits this enzyme. Also, I have seen many guys recommending, because some guys in PFS, they have really high prolactin. Shisandra is really great by reducing prolactin induced by estrogen, okay? And some of these coaches are recommending Shisandra, but the problem with Shisandra is it also regulates CYP3A4 enzymes, okay? So it's great herb, I like it, but it can have negative effect, okay? What else you can do? Lemon water, dried organic lemon peels. It was my daily standard, okay? So I always start day with a little bit of warm water with a lot of lemon juice, but freshly squeezed, okay? And with organic lemon peels, okay? I like it. My inflammation is low because of that, so I don't need to use something expensive or complicated, okay? So why also some men, they don't have such a big issues with finasteride, okay? There are studies, okay, that one positive effect of finasteride is that it increase IGF-1. Okay, it's not increased in every person, okay? So you can check your blood IGF-1 levels, okay? So, but I have seen with some of my clients, okay, there are studies proving that, okay, that in some people it can increase IGF-1, okay? IGF-1 is stimulates the activity of 5-alpha reductase enzyme, okay? So then if finasteride work against hair loss, it's not because of somehow blocking DHT, okay? But like I said, it's more like enzymatic reaction. Maybe the IGF-1, it's not so involved by generally IGF-1 stimulates the activity of 5-alpha reductase enzyme. And for example, there are DP cells in balding scalp, and they have, for example, much less of IGF-1. So IGF-1 increase from finasteride will help prevent balding. Okay, this is, but only in few people. I had also 2 clients that been taking finasteride, minoxidil, and so on, and they have really high level of IGF-1, and they had really less issues. Okay, so that can be one of the mechanisms why some guys, they don't experience such a big issues from finasteride, propecia, and minoxidil, and so on. Okay, so also DHT androgen levels. Okay, so some guys have much higher testosterone and especially androgen like DHT, okay? So, and that's the compensation for DHT reduction, okay? So, also another thing why some guys, they don't experience such a big issue are neurochemical factors, okay? So, variability in neurotransmitter system, okay? They have, it was like me, okay? So I had always higher dopamine and oxytocin, okay? So, and it will protect you against side effect, okay? You also need to know that, for example, oxytocin is boosting 5-alpha reductase, okay? So it potentiate 5-alpha reductase enzyme, and also DHT. There is a loop between DHT and 5-alpha reductase. DHT will boost 5-alpha reductase, more 5-alpha reductase will boost DHT, okay? Also, balance of other hormones like prolactin and estrogen has significant effect, okay? Because I was always guy with lower prolactin, okay? So my lowest prolactin was 4 something, okay? So prolactin inhibits 5-alpha reductase, and sometimes even if you need to like reset prolactin for a prolonged period of time in order to really restart 5-alpha reductase activity. Okay, so because some guys they take prolactin down, but they still experience issue, and they need also some other help like IGF-1, DHT, even proviron, and so on in order to restart. Because I think the prolactin reset would help, like to keep prolactin really low, like 4 to 7 max nanogram per milliliter. Okay, so also if you have high inflammation, okay, so CRPL6, it has significant inhibitory effects on the synthesis of DHT by inhibiting 5-alpha reductase. Okay, so everything that blocks inflammation will help. Okay, I had guys where they took taxifolin as my recommendation, also with some, of course, with other things that was in the stack, and they took taxifolin and they told me that their condition really improved. For example, I also took taxifolin because taxifolin is neuroprotective. Okay, so also like nicotine. Okay, so I was smoking a lot, but I don't recommend nicotine, but nicotine is also neuroprotective. Okay, so I would rather recommend glycine or something like taxifolin. Okay, so taxifolin was also used for COVID. It has really strong anti-inflammatory properties. Okay, so also at that time I was eating a lot of bone broth, a lot of gelatin. I grew up in Eastern Europe, so for me like chicken soup or bone broth soup was like everyday thing. Okay, so and my body was craving for glycine because as you know, glycine is like nutrient or amino acid that you will get from broth and so on. Okay, so and NMDA agonist will increase 5-alpha reductase mRNA, okay, and DHT levels. So glycine is one of these NMDA agonists. Okay, so especially is helping with 5-alpha reductase 1 in brain tissues. Okay, so therefore it was so helpful for me. Okay, so you can start really slow, okay, because for some guy it can be really too much, okay, like 15 grams and so on. Okay, so I like it from natural sources. I eat a lot of this kind of gelatin and broths and so on, but also I was supplementing. Okay, so like I told you, okay, neurochemical factors and genetic differences. Okay, genetic polymorphism affecting androgen receptor sensitivity. Okay, here one thing why proviron can be affected for some guys. Okay, so don't take proviron as solo therapy. Okay, so proviron there are studies been proven that can help with things like this genetic polymorphism. Probably is the only one synthetic androgen that has been proven to work for something like this. Okay, so proviron was one of these. Okay, and okay, like I told you, also estrogen is the most potent negative regulator of testosterone production and has inhibitory action on 5-HT. Also, prolactin should be in a certain range, like 20 to 25 picograms per milliliters. Okay, and like I said, even if you are on TRT, okay, and you are not seeing results, okay, so you need to take a look at IGF-1, you need to take a look on prolactin, estradiol, okay, and it need to be fixed. Okay, also your inflammation, and yeah, that's it, guys. So let me know what you think. I try to give you as much as detailed information on this topic and how you should recover. Okay, let me know. Bye.